very good morning to everyone. So, welcome to our forum. Mind and operation when navigating student anxiety. So, today we will talk about one of the most common struggle among students, which is anxiety. Many of us face pressure from studies, family expectations, and our own fear. Anxiety is something real, and if it left unchecked, it can affect both our mind and body. So before we dive in deeper, I want to introduce our diverse panelists joining us today. So on my far right, we have Dr. Afi, who is a psychiatrist, and next we have Ami, a student, and next we have Dr. Aksan, who is a medical doctor. And on my far left, we have Ustaz Adi, who guide us through Islam, and we have Haziq, Mr. Haziq, as a parent, and lastly we have Nopat as a counselor, and as for the moderator, which is me, Muhammad Zaiful. So let's begin our first round of discussion. To start with, I want to ask someone who familiar with this topic, which is the Dafi. The Dafi. What is exactly anxiety disorder? How can we understand it scientifically?
Thank you, Mr. Director. So basically, anxiety disorder is a medical condition where the brain fear system become overactive. So let me paint a picture for you. So in the brain, there's a part called amygdala which detects danger. So scientifically, this amygdala sends false alarm and make the body think something bad is happening, even when it's not. So this trigger the release of cortisol, adrenaline, and stress hormone that cause the heart to race rapidly, hands start shaking, and sometimes even sweating. So if this condition continues for a long time, student manifest the difficulty to sleep, sometimes constant worrying, and panic attacks. So anxiety disorder is not a weakness, it is a real medical condition that needs support and understanding.
Thank you, Dr. David. That's very clear. Now, Dr. Aksan, as a medical doctor, how do you see anxiety disorder affecting student physical health?
Thank you for Jordan. In my point of view, anxiety is not only in mind. It can also show in the body. Many students come to clinic and openly or headache and stuff like that. It may be triggered by the anxiety. When anxiety is chronic, the stress hormone cortisol weaken the immune system and cause the digestion problem. It may cause a problem for the student that will wake up and stay awake until 3 a.m. Thinking the assignment, the process of stress, it also the weakness, the weakens memory cell and not stay focused. And some people realize what they feel and then energy drink to stay awake. So the anxiety is really need attention because it's effect of both mental and physical health.
That's nice for me. Now, let's hear from Ustaz Ali. How does Islam guide us in facing anxiety?
Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Anxiety is a type of blood. Even the Prophet Muhammad SAW is a moment of fear and sadness. And Islam teaches us how to respond. In Surah 24, ayat 6, the verse is in the mind of Yusra. It means, indeed, leadership will be easy. So this verse remind us to how difficult temporary are. In cycle, Allah will provide and And also Islam teaches us the concept of tawakal. Tawakal means trusting Allah after we do our best, not just we sit in and we do not nothing. But we must to ready, prepare and study to live the result to Allah. Okay. Okay, next. The Prophet Muhammad SAW said in hadith, okay, if you were to rely upon Allah with the reliance, He is due. You will be given provision like the birds. They go out hungry in the morning and return full in the evening. Okay, lastly, they show this reliance and faith in trust. Okay, when students feel anxious, remember study and pray. Because I always reminded to all people one doa, which Ya Allah, I leave the outcome to you. So this doa give to you all peace and income. Thank you.
It different mind of study. Now, I would like to hear from a parent perspective. So, Mr. Haziq, how do you see anxiety in a child?
As a father, I can say it very painful to see our child suffering from anxiety. My son used to lock himself in his room before exam. First, I thought him lazy because he don't go out from his room and don't even eat. But one night, he broke down and said, "Mom and Dad, I can't do it anymore." That moment changed me. I realized we as children, must not pressure him, but we must make him comfort and he can share their problem to me as a father. And in our culture, we tell our son to study hard, not to overthink. But after that moment, I realized to make my son study as he want, but if he don't want to study, I will also and that's all.
Thank you, Mr. Haziq. It was very helpful. Now, Mr. Nawfal, as a counselor, how do you explain anxiety to your students?
When I tell them that anxiety is just like our clock in our brain that things go off. After that, it brings not only when there is the planning reaction, but even even during small challenge, that's like presentation or proposals. After that, I tell them that our doubts can trick us. For example, they talk about I will fail and everyone will love it. But often it's not true. And our body will break if it is failed. So that's why counselor will focus on the training brain, calming the body and changing those negative thoughts. That's all.
Thank you. And finally, I'm a student. Can you share your own experience with anxiety?
Honestly, anxiety has been part of my life since grade school. Before every exam, my heart beats so fast. My hands keep shaking and I can't even follow time properly. Once during a presentation, I froze in front of class. I could hear my own heartbeat and I felt like running away. What made it worse is when people say you're operating. It feels lonely, like nobody understands. But slowly, with the help of a counselor and support from my friend, I learned that I'm not alone. Talking about it really helps.
Thank you to all panelists for your insight in this round. Now, let's go deeper into how anxiety impacts student life. Tapi, how severe can anxiety become if untreated among students?
So if anxiety is not treated well treated, so it can lead to panic disorder or depression. Students may start avoiding classes, skipping exams, or isolating themselves socially. In some extreme cases, anxiety can lead to self-harm or suicidal thought. That's why early recognition is very important. Students should not shame to seek help.
Thank you, Dr. Atif. The other answer, what about long-term effect on body?
Chronic anxiety is deep worry in type of black holes and easily increase the risk of high blood pressure and heart problem. Even memory will decline. Students think it's just stress, but in long term, it's damage the health. This is why I always be a reminder for my students to take care of their sleep and diet, also exercise because physical health support mental health.
Thank you, Dr. Mr. Eddie, what spiritual effect do you see when students suffer from anxiety?
Thank you for the moderator. Anxiety can make a student feel hopeless and distant from Allah subhanahu wa ta'ala. Okay? Islam teaches us that Allah subhanahu wa ta'ala is closer than we think. Okay? In Surah 24, ayat 23, Allah subhanahu wa ta'ala said, "Qul ya ibadiyallazina asrafu ala anfusihim la taqnatu min rahmatillah inna Allaha yaghfiru dhunuba jami'an innahu ghafurur rahim." Actually, do not despair of the mercy of Allah. Even the darkness, but His mercy is greater than our fear. Thank you.
Thank you, Mr. Eddie. Mr. Haziq, how has anxiety in your child affected family life?
It affected our whole household. Sometimes my son avoid family gathering because they think people would ask about his marks or grade. And sometimes we argue because I misunderstood that his behavior as a rebellion. But I realized that he also needs empathy. Instead of saying why you can't be like this, I'm saying, don't worry, I'm here for you. That small change improve our relationship a lot.
Thank you, Mr. Haziq. Mr. Naufal, how do you see anxiety affecting student academic performance?
Students with anxiety will study online but forget everything in the test. But because their brain is popular, students some of them will avoid group or daily class with instance. I always remind them that grades don't define your worth. They stress and the confidence will make them more committed. That's all from me.
Thank you, Mr. Naufal. Now, Amin, how has anxiety affected your student life?
It made me doubt myself. Even when I got good results, I felt like it was not enough. Anxiety also affected my friendships. I avoided hanging out with my friends because I was scared. People would judge me. But after opening up to my counselor, I started to understand my triggers. For example, when I take too much caffeine, my anxiety would get worse. So I avoid coffee before exam. Small change helps a lot. That's all.
Thank you to all panelists. Now, let's move to practical solutions. How can students cope with anxiety? But Afi, is someone who familiar with anxiety disorder? What are the treatment options for anxiety?
Right, so there are two main approaches. First one is through therapy, and the second one is medication. So in terms of therapy, we have these terms called cognitive behavioral therapy (CBT), which helps students to identify negative thought and replace them with a realistic one. For example, instead of saying "I will fail this exam," we reframe it as "I have studied, I will do my best, and that is it." In severe cases, medication such as antidepressants or anti-anxiety medicines may be set, but most likely medication is only used under close supervision and alongside therapy.
Thank you, Dr. Afi. Now, Dr. Azan, what lifestyle advice can you give to the students as a doctor?
I have some advice that may help some people for anxiety. It's simple, but it's powerful habit. First habit is sleep well. Only have 7 hours to sleep because the process memory of the brain cell when you sleep. And second is exercise. Just 30 minutes of walking can reduce the anxiety. And third is diet. Eat and consume well and follow the healthy diet and don't take much caffeine and sugar. And lastly, it's very easy, it's breathing technique. So the breathing technique is you may have slow and deep breath come to the nervous system. If students treat their body well, the mind will follow. That's all.
Thank you, Dr. Azan. Now, Dr. Ali, what can students do spiritually to calm anxiety?
Okay. Islam give us a beautiful tool, okay, which is zikir. Many zikir that can do. So the simple one is Subhanallah, Alhamdulillah, and Allah Akbar. Okay, and then not just zikir, also salah is way to release stress. And then Prophet Muhammad sallallahu alaihi wasallam said in one story is Bilal give us comfort by the prayer. Okay. Prayer is not per day. So I advise to all that when overhang, make wudu and take a prayer to rakaat. So after take a prayer, ask Allah, and then you can feel calmness to the soul.
Thank you, Sari. Now, Mr. Hasan, what practical steps can parents take?
First, parents should listen without judging. Sometimes our child just need to be heard. Then, second one is encourage, not compare. Stop saying like instead of saying, look at your present. Because the result is unique. Third one is, the relationship work together with their sit and sit with them to plan a study schedule. And last but not least, seek help if need. Don't be shy to see a counselor or a doctor.
Thank you, Ms. Haziq. Now, Mr. Naukat, as a counselor, can you share specific techniques students can use in
One method is 5, 4, 3, 2, 1. Focus on what you can see, touch, what you can see, touch, smell, and taste. And after that, we can use methods flow breathing. Inhale for second, hold for second, and exhale in 6 seconds. It can help for calming our body and mind. That's a problem.
Thank you, Mr. Naukat. Now, tell me, what method worked for you perfectly?
For me, talking to someone I trust helped a lot. I was scared to see the counselors, but after I did, I realized I was not here. I just needed guidance. Also, I started exercising, even just short walks. And before exams, I do short prayers and breathing exercise. Those small things made a big difference.
Wonderful. For our last round, I would like each of you give a closing reflection or message of hope. And we start with Dr. Amin.
Right. My message, anxiety is treatable. If you feel overwhelmed, please seek for help. Mental health is as important as physical health.
Now, how about you, Dr.
It's simple. Take care of your body. Sleep, eat, and exercise well. A healthy body helps the healthy mind.
How about you, Ms. Adi?
For me, always remember to Allah, tawakkal, have faith with the peace, and lastly, Allah never overlook.
How about you, Ms. Adi?
To students, your parents love you more than your grades. And to parents, listen more, judge less.
How about you, Mr. Naukat?
You have not developed anxiety does not define you. With the right tools, you can overcome it.
Now, how about you, Amin?
To my fellow students, do not keep it inside. Talk, share, and seek help. You are stronger than you think.
Thank you to all panelists for your wisdom, and thank you for audience for joining. We learned that anxiety is real, but it's not yet. With science, faith, family, counseling, and self-care, we can navigate it together. That's conclude our forum. Mind Under Pressure, Navigating Student Anxiety. Assalamualaikum and thank you.